And to walk us through this health challenge in children is the director, Ike Foundation for Autism, Mohie Francis Oko, who joins us live from our Abuja studio. Good to have you join us.
Thank you very much.
So we have 17 million people who are impacted by this disorder around the world. It makes it one of the most common physical disability affecting children. So why is this not receiving the necessary attention as it should?
Okay, thank you very much. It's actually a discussion that has to be given more attention, and for lack of what the challenges is, so to speak, it's more on awareness, Therefore, a day like this, every 6th of October, globally is set aside to basically increase awareness, advocacy, and of course support, and more so action towards supporting persons and families living with cerebral palsy.
We did a recent story, one of our correspondents here, Adedoja Salamadini, did a story on a child with cerebral palsy who is a chess prodigy. He is great at chess. It shows you that some of these children are gifted, yet, you know, we find that as society and family members seem to write them off, no proper education, no skills impacted, and then they end up being dependent all their lives. Talk to us about what you have noticed to be the reason for this.
Okay, thank you very much for this very important point. It goes back again to the issue of awareness. And I tell you what, for persons living with disability, today our emphasis is on cerebral palsy. There is always strength somewhere. So that if we are able to pay more attention, increase awareness, advocate more, we will be able to identify those strengths which they have and harness it. I will tell you something. You know, over time, we've paid more attention to the negative aspect of things, so that the word disability, we have paid more attention to, like I said. But it is time for us to remove that first 3 letters, DIS, and perhaps replace it with what I describe as THIS. So instead of saying this ability, let us now focus on this ability, because for every individual diagnosed of cerebral palsy, they have strength, upon which if we're able to harness it, they will do great exploits. And we have quite a number of them around.
Absolutely, and that's why one wonders why, because our education seems to be very straitjacketed. It is for those who, you know, you have to meet a certain standard to be able to fit into the education system here in Nigeria. What sort of structures should we put in place if we are to improve the lives of of children living with cerebral palsy?
Thank you very much. Again, it goes back to the formulation of policies. And not just formulation of policies. I understand the recently signed 2019 Disability Act that was signed into law. There are provisions for persons living with disability and all of that. But quite unfortunately, that is just in theory. The government is trying its bit, but it's not enough, you know, again, to capture these persons living with cerebral palsy. So let's go back to issues of policy formulation, training and retraining of teachers, medical personnel, just like the woman that spoke earlier during your introductory part of this discourse. You discover that most doctors do not even understand what the needs are. So that when a parent gives or a mother gives birth to a child, we will advise that let that child be kept in that hospital for a number of hours, if not days, so that there's more critical observation done on that child. Because sometimes there's what we call jaundice. A child could be born with jaundice, and you might not discover it the first few hours or first few days. And when this parent is asked to take the child home, trust me, that can happen at home, and the parent will be helpless on what to do. So it cut across all spheres of this, these challenges. Let's go back to even the school system. Teachers do not understand what these needs are. So training upon training, caregivers including all categories of caregivers, medical doctors, teachers, therapists, and all of that. So by the time we're able to train people, create more awareness, I think the interventions will be such that persons living with cerebral palsy can get great help really great help.
And it's safe to say thank you to you and others who are bringing light to issues like this. Thank you so much for your insight, Mohie Francis Oko, who is the director, Ike Foundation for Autism.
Always a pleasure. Thank you very much.